Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And today I wanted to talk about borderline personality disorder and self-mutilation. But before I get into this, one thing that I think is really important is that people realize that there are other disorders associated with self-mutilation and self-harm. And I think that a lot of people, this is mental health providers, medical doctors, other folks included, that they believe that because someone self-harms or hurts themselves, engages in self-mutilation, that means they're borderline personality disorder. And it does not. It absolutely does not. And as we go through the video, I'm going to talk about other disorders that also have a high probability for self-harm as well. So it's important to know that. Okay? So let's get started. The first thing I want to talk about is that about self-mutilation in non-clinical populations. These are folks that are not in hospitals or anything like that. And when we talk about self-mutilation, we're talking about 4% of the general population. And also 14 to 35% are college students. Now, college students in these studies, what you're talking about, individuals that are between the ages of 18 and 32. Okay, so you've got 14 to 35% of college-aged individuals are engaging in self-harm and self-mutilation. Okay. Now also, when we talk about, and I mentioned before, about those diagnoses that have a high probability of self-harm include, you have substance abuse, eating disorders, PTSD, major depressive disorder, anxiety disorders, schizophrenia. It is not just borderline personality disorder. It's important to know that. That's often a huge misunderstanding that I run into with a lot of my colleagues and things like that. They just sort of compartmentalize self-harm equals borderline personality disorder, and that isn't true. There are 9 criteria for borderline personality disorder. Only one of them involves self-harm. Now, what about for those who do engage in self-mutilation and self-harm? What about the means, the ways in which they do it? Well, about 75% of those cut themselves. About 21 to 34% tend to bang or hit their head against things or hit themselves in some way. And about 15 to 35% burn themselves. Now, what's important about this number is that it doesn't equal 100. So what does that mean? What that means is that people have more than one way that they engage in self-mutilation and self-harm. So if you're a mental health provider and you're watching this, it's important to recognize that we have to ask folks how they harm themselves. If cutting is their main way that they harm themselves, what about if they don't have that means to do that? What about, do they then engage in hitting themselves, burning themselves, other type of self-mutilation? So it's important to know that as well, and be sure that we're asking for primary methods, secondary, and tertiary methods as well. Now, what about by gender? When we look at people who engage in self-mutilation, we look at gender, a lot of people believe that females engage in self-mutilation more than males. And that actually isn't true. What the research shows is that it's inconclusive. And that means that we're not sure. We're not sure if it's more men or if it's more women. It's important to bear that in mind, that as you look at different studies, some will say more than women, some will say more men. So we're inconclusive. The field is uncertain if more men or more women are harming themselves. So bear that in mind. And also, what about why? Why do folks harm themselves? Now, this is specific. This information comes from the research as well as from experience with my clients as to why they engage in self-mutilation. Now, a number of my clients engage in self-mutilation to make anguish known to others, so that others will know the pain that they're feeling. Sometimes revenge on a partner. Other things could be to force someone to demonstrate a caring act. If they put this in their mindset, they think, well, I'm going to hurt myself and you're going to come and rescue me, and that will prove to me that you love me. And when we do those tests, if you see my other videos as well, and we talk about this, those tests never work out well, okay? And some folks engage in self-mutilation for anxiety reduction. Other folks, they have what's called an internalized other. And this is, if they've experienced abuse, what happens is that they hold on to this, it's usually an unconscious ideal, that I will treat me the way you want me to be treated. So because they believe that their caregiver or their loved one wants them to feel pain, wants them to suffer, wants them to harm themselves or show that they have low value, they internalize this idea and they act it out. And it becomes a recapitulation, becomes a cycle that they engage in over and over again. But the other reasons are sometimes to end an argument. Folks will cut themselves or harm themselves to punish a perceived bad self, that they believe that, so I need to harm myself because this part of me is so bad and broken and bruised. And then lastly, to feel something, to relieve this sense of numbness. And we have to be careful, because I know that there are a lot of sites out there and a lot of things out there that say that if you say this, people will stop asking. I'm not one of those clinicians. I keep asking. I think that I want to be sure. I think that a lot of folks believe, well, if I just tell you that I do it to feel something or to release anxiety, then you'll leave me alone. And we're going to talk about sort of the steps, the sequence that we engage in for self-mutilation, my clients engage in for self-mutilation. And I think it's really important to know that. We'll talk about how you can use that to help yourself as well. So let's talk about what are the different types of suicidality. So the first one, this is called just this like parasuicidal. It's parasuicidal gesture, and that's that self-mutilation. And after that, if it steps up, you have what's acute suicidal ideation. And this is because you've experienced some type of temporary stressor or severe stressor that you believe that suicide is an answer. And it's important to realize this, that people have a misconception that suicide is a singular act. Well, it's really not. And what the research shows is that when folks do complete suicide, it puts their children, their parents, their grandparents, their friends, everyone that's in that interpersonal circle at a very high risk to believe that suicide is a viable option. So not only are you harming yourself, you're also harming the ones that you love and care about. So it's important to add that sense of reality to that as well. And of course, if you know someone, or if you're thinking about harming yourself or suicide, I will put the suicide hotline number right here, as well as throughout the video, because it's really important to get help and explore this issue. Okay, so that you could be safe, your loved ones can be safe, and that there are alternatives. I know even when it's dark and you don't think that there are alternatives. And folks who hang on to the idea that suicide is a viable option, they have what's called chronic suicidality. And these are folks that are always thinking of suicide, about how they can end their life, about when to end their life, things like that. And it's important, again, to realize that it is not a singular act, that if you were to complete it, there's a high probability that your children and your parents and other people would follow suit. Now we're going to talk about the sequence that a lot of folks, now not all, but that a lot of folks engage in when they get to self-mutilation. Now this sequence is by Lorna Smith Benjamin. She's a wonderful psychologist, very, very brilliant psychologist. And I think that this tends to be very accurate. Okay, so what happens first is that you're devalued by the caregiver. Now, caregiver can just be any object of value. It could be your boyfriend, your girlfriend, your significant other, your mom, dad, brother, sister, cousin. Sometimes it could be your boss. It could be whatever it is, but you get this sense of being devalued, of being unimportant. And then what happens is you engage in withdrawal. So you then go to a private place. You may go to a bathroom, a bedroom, into your car, somewhere where there aren't other people around. Once you're there, then you engage in dissociation. And there are varying degrees of dissociation. I did a video on dissociation. I'll put that clip here if you're interested in that or you experience that. So that dissociation. So then once you've disassociated, then you have to believe that this thing that you are going to mutilate is worthless, that it holds no value, because otherwise you can't mutilate it. And after you have devalued it and you see it as worthless, then you engage in the act of self-harm. Then you engage in that cutting, burning, hitting yourself, whatever it may be. Now, if the sequence stopped there, we wouldn't have these issues of people engaging in self-harm, but we don't, because it ends up in relief, some type of relief, whatever that may be, and it's different for everybody. And it's important to identify what is that relief, what is that you hope to achieve by engaging in self-mutilation. Because what happens is, and a lot of my clients that may be cutters that do tend to cut themselves, they are cut on multiple parts of their body. Some are not able to wear short sleeves. Some are not able to wear shorts because of the degree of self-mutilation that they've engaged in and their scars and things of that nature. And breaking up this sequence has helped them. And the way that we do that is, okay, so we recognize the first part of the sequence is devaluing by the caregiver. So you're devalued. Well, what I like to do with my clients is build this sense of self, build this sense of empowerment so that your value of self is not dependent on someone else. So that's component one. Well, let's say that you're having difficulty with that. You can go to number two. You can go to step two. And step two is that withdrawal, is that you withdraw from the area. You go to somewhere where you're isolated. And what I tell some folks is go where it's populated. You can go to a mall, go sit in the living room, right, where your folks are, your kids are, somebody else is, and do that. Do where other people, go where other people are around so that you're not withdrawing. Then that dissociation. Now there's a lot of different techniques that you can use to combat and manage or lessen dissociation. Mindfulness is great. Again, I talk about all of this in that video on dissociation, on how to stay grounded, different grounding techniques, different things that you can do to prevent yourself from dissociating. Then we have that sense of worthlessness, about seeing your parts of your body or yourself as worthless. And it's important to then, how do we deal with this? You deal with this by finding worth, finding value. What gives you a sense of value? Just as I talked about in the previous video, which was inner critic, which was about that, to have value or to see yourself as a good person doesn't mean that you have to save people from a tsunami, or you have to, save 100 cats from a burning building, or whatever it may be. All those are well and good, but those are rare instances where it would show you to be the hero, to show you, I guess, that you have value. But everyday kindness shows that you have value. Holding the door open for someone, saying thank you, being courteous, using manners. Those things, it may sound cheesy, it may sound ridiculous. I hope it doesn't. But these are things that actually have value, that good people have value. Good people pass it on. And that can give you a sense of worth. There is research that shows by doing nice things for others increases your sense of self-worth. And they don't have to be grand gestures. They can be smaller gestures that give you that sense of satisfaction, a sense of pleasure, and a sense of fulfillment in who you are and the type of person that you are. And so the next step from that would be engaging in that self-mutilation. If you're a cutter, can you take all the razors out of your house, throw them away, and use electric razors? For women, I know electric razors, I've heard, are not great. But still, it's better than having the means to cut yourself. Burning yourself, try to get rid of all the matches or the lighters or other types of things. So make those means difficult to do that. I hope that, and then at the end about the relief is, how can you find other ways to get that sense of relief, to get to that end goal? How do you do that? There are ways that you can do that. You have to figure out what that relief is and talk maybe with a mental health provider. That would be great, about how to get to that sense of relief, that sense of self-satisfaction, so that you don't have to engage in this sequence to get the end result. You don't have to engage in maladaptive patterns to feel like that you've achieved that end result, that sense of relief, whatever that relief is for you. So I hope that this video was helpful for you. Again, if you are thinking of harming yourself or suicide, please call the 1-800 hotline. The comment section is not appropriate to say that you are thinking about harming yourself. It is not an emergency access or anything like that. That's what the National Suicide Hotline is for. Going to an emergency room, taking care of yourself is really, really important. Okay. And I hope that you'll do that. I hope that you learned a lot. I hope you'll try some of these strategies, and I hope that it lessens your probability or your propensity to self-harm. And I would love to hear that. If you try the sequence and it's helpful, please leave some feedback. I know that would help other people, and that would be really great. And I want to say thank you again for your time, as always. And please take care and please be safe. Thank you, and have a good day. Bye-bye.